Although one may expect people to attend church to pray, on Saturday evening, one Oak Park Parish mixed church and the state of healthcare reform. About 120 people came to St. Giles Catholic Parish to attend a forum posing the question, is healthcare really a right? According to one of the event's organizers, Dorothy Doherty, healthcare reform is an issue that adults need to learn more about.
We are citizens and need to be involved in what's going on in terms of issues in our country. And a huge issue right now, and has been for a long time, but it's finally been brought to the fore, is healthcare reform.
Father Thomas Nairn, the Senior Director of Ethics at the Catholic Health Association, said healthcare isn't just a human right, it's a Catholic value.
Catholic Health Association has been part of the whole question of healthcare reform and justice and the issue of healthcare as a right forever. We've been working very consciously for the past 5-6 years, so this is not something that just began with President Obama. And our position comes right out of Roman Catholic social teaching.
Jesus said, feed the hungry, clothe the naked. So those are not simply optional. Same thing with healthcare. Healthcare, interestingly, probably even more so regarding common good.
Doherty agrees, believing Jesus would be pro a public option.
Being a citizen, being a Catholic, for us, the teachings of Jesus have to do with caring for everyone. I actually believe health care is a moral issue before it's an economic one.
Nevertheless, it is an economic issue, a big one, which is why it's taken so long for reform to actually happen. Steve Sarakaku, a member of the Illinois Single Payer Coalition, explained the financial benefits of a public option.
As Father Nairn said, who would you rather have between you and your doctor?
Please, the president said that.
Right. But the next best thing to the president. When you have an insurance company bureaucrat who has a profit motive, between you and your doctor, that to me is a lot more scary than having a government bureaucrat.
3 Q&A sessions were also part of the nightly chat, and there was never a shortage of inquiries.
My name is Dominic Doherty. A question about the human rights thing. Is there any stage at which irresponsible behavior can allow people to refuse you this right? Like if you're a chain smoker for 30 years, 500 pound overweight, can they refuse you a lung transplant? Just as you are refused freedom if you behave irresponsibly.
As I said, all 3 bills have penalties for irresponsible behavior.
Oh, I thought the conversation was excellent. The only way we're going to do this is by honest public debate.
The Bishop of Sioux City has made public pronouncements saying that access to health care is not a human right.
So have the bishops of Kansas City, Missouri and Kansas City, Kansas.
Yes.
And public debate is not just yelling at people. It's honest difference of opinion, explaining why, being challenged in that, and explaining why again. And that's what I tend to think was going on tonight.
St. Giles isn't the first house of worship to hold a healthcare-related event, and according to Doherty, hopefully it won't be the last.
Being Catholic and being part of a community and seeing how people need to be cared for, each and every one, we felt it was important that we hold a forum so people can be informed.
This is Melissa Suran for Wednesday Journal.